All right. Hello, everyone, and thank you for joining this video, which is part of the Brigham and Women's Hospital Genetic Counseling Career Day event. There's going to be a live event with more sessions and interactive sessions of that on July 20th. So if you've registered with the Eventbrite link, definitely attend that session, and the link to that event is also at the end of our presentation. But this video is going to be designed to give a bit of an introduction to genetic counseling as a profession. I'm Elizabeth Fieg, and I will be presenting this video with Tala, who is also a genetic counselor. All right, so just to give a little bit of background about myself, I went to Connecticut College, which is a small liberal arts school in Connecticut, not to be confused with UConn. That's a big school. I went to a small school. I designed my own major in genetics, and I double minored in history and psychology. I found out about genetic counseling as a career the summer before my freshman year of college, so I was able to take steps to kind of design my my classes and my major to fit what I would need to go into a genetic counseling program. And I went straight from undergrad to a graduate program in genetic counseling. I went to the Boston University Genetic Counseling Program, and I graduated in 2014. And I went straight into the job that I have now at Brigham and Women's Hospital in adult genetics.
And I'm Tala. I have a little bit more of a journey to genetic counseling. I am from San Francisco, and I went to Boston College for undergrad. I actually didn't hear about genetic counseling until my senior year of undergrad. And so while I thought it was interesting, I didn't want to, completely switch gears. So I ended up working at a neuroscience lab. So that's the cognitive and affective neuroscience lab for about a year and a half after I graduated. Simultaneously, I did some volunteering with RAIN, so that stands for the Rape, Abuse, and Incest National Network. So I was doing both of those things while I figured it out. Then I went to grad school at BU, like Elizabeth, but I graduated in 2018, so a little later. And now I work at Brigham, and I came here right after grad school.
All right, thanks, Tala. So let's start with the basics of what is genetic counseling as a profession. And so really, I think at the core, genetic counseling is a communication process. So different ways to convey information to patients, to other healthcare providers, in ways that relate to medical genetics and different risk information or information that people could use in different ways. So often, this involves counseling at the core to provide information to people that is up to them how that is used or not used. Genetic information is complex and can sometimes have an impact on medical management, but often it's not. So it's what meaning does that information have for somebody? What might be useful or not useful about genetic information? Is genetic testing something that they feel would be valuable to them or not? It really is making sure that people have information to make an informed decision about testing and decide what value, if any, genetic testing has. So we might help facilitate the process of evaluating risk for patients and work with different providers in that setting. So it can definitely range in terms of the colleagues and other people on the genetic counseling team or healthcare team, the type of patients that we're seeing. Definitely there's a range of different referral reasons in different areas of clinical counseling, as well as some non-clinical positions or non-patient facing roles that genetic counselors have. But really, regardless of the setting, a lot of it is communication and education as the kind of key aspects. Genetic counselors have training in medical genetics and in psychosocial counseling. So again, that communication process, making sure that we are able to work with and kind of meet patients where they're at, regardless of background or language restrictions, and really provide information about various aspects of genetic disorders, how they might be inherited, what genetic information means in terms of different risks for diseases that are monogenic, meaning that they're caused by one gene and one genetic change, or might be more kind of complex and multifactorial. And then really, making, again, decisions about genetic testing, what tests might be appropriate or available to offer a patient in any given situation, and what that means for their healthcare for themselves and for family members as well. So really support them through that process of finding out more information, deciding how to use it, and then implementing it, if appropriate, into their healthcare. And so, in practice, there are different ways that we do this. I think a big part of our role, as we mentioned earlier, is education and communication. Often we're advocates for patients and families, either in a direct patient role with working to help get resources or help get genetic testing covered, or just work with an organization themselves or patients that are affected with a specific given genetic disorder. So really being able to take complicated information and break it down for people, again, whether that's patients, other healthcare providers, people involved on the insurance side or with patient organizations, but really be able to have these conversations in meaningful ways. And help people through the process of getting a diagnosis or going through genetic testing, sometimes getting back information that might have been unanticipated or unexpected for them, and provide whatever resources or support might be useful afterwards. So whether that's a referral to a different specialist, or helping provide somebody with different resources about their genetic condition, maybe genetic testing confirmed a diagnosis for them. And so the next kind of question is, how do I talk to my family? How do I talk to my kids about this? That kind of thing, or connecting them with other people who also have the same genetic condition and might be going through a similar experience. So diagnosis is definitely a piece of it, but again, I think at the end of the day, education is what ties everything together for what genetic counselors do day to day, and really what it kind of looks like in practice. All right, so there are a lot of situations in which somebody might be seeing a genetic counselor. They might have had different screening tests done, or findings on ultrasound if they're pregnant. They might have a history of medical problems and are coming to be evaluated to see if there's an underlying genetic reason, kind of tying everything together and explaining why they have these problems. There might be a family history of a genetic disorder, or somebody's had positive genetic testing. Maybe the patient has, and they're coming to you to talk about what it means. Genetic testing is sometimes ordered by non-genetics healthcare professionals, so not a genetic counselor, not a medical geneticist. And so sometimes our role is to have conversations that ideally would have happened before testing was ordered, but the patient's coming to us after that fact, and so trying to go over it with them then. There might be, again, family history where somebody's having carrier testing done, or diagnostic testing, or pre-symptomatic testing. Sometimes, it's information that other family members are interested in, and so the patient's coming to try to help facilitate that process. So there really are many different reasons. People can be at very different points in their life. Patients, there are newborns who are kind of prompt a genetic referral. Tala and I both see adult patients, so people that are older, and maybe genetic testing was done 20, 30 years ago, but it was very basic at that point. So now the technology's changed a lot, and they're coming back for evaluation. So many different reasons, but there are definitely a lot of different indications that might bring somebody to see a genetic counselor. Sometimes it's not even indication based. Someone might be just kind of interested in learning more about genetics. Maybe they had direct-to-consumer testing, 23andMe, something like that, and are interested in going over those results, or kind of learning more about what this means with an expert and a genetic counselor. So the sessions for genetic counseling, so seeing patients and meeting with patients, varies a lot, kind of what this looks like depending on the different specialties. So there are some areas where genetic counselors are quite autonomous and pretty independent. They might see patients themselves. Patients would be typically referred by a physician or a self-referral, but the genetic counselor might just meet with them in their office and go over a session then. Other providers or other genetic counselors see patients with the physician. So often in the pediatric setting or in adult genetics, it's kind of standard that a medical geneticist is involved in our appointments as well, because there's a physical exam that's kind of the standard part of the appointment that happens. So typically, things start off similarly. Contracting is a big part of the appointment. So going over, what brings somebody in, what do they know about the reason for this appointment, if anything, is often a good starting point. And really, figuring out what that patient is hoping to get out of this in the appointment. Often we have our own reasons for why we think someone's coming or why they were referred. So making sure that we're all on the same page and can kind of set some mutually established goals for what's going to happen, and make sure that we're on the same page with the steps involved. So going over medical history, family history, that kind of thing. A lot of it is information gathering. So sometimes we have patients where there might be many medical records for them in the system that we have access to. So we're able to review their history in detail. Other times we don't have anything. So we might need to gather information and go through review of systems, figure out about their medical history, especially for adult patients when there is a history to go through. They've had years of their life. So trying to better understand the history. And that's often guided by the indication for the referral, and going over family history as well, since our genes are inherited. So we like to take a look at the family and see, are there people in the family with similar types of medical problems or differences that would be suggestive of a genetic etiology. Sometimes this, we have a very big family, and so there's a lot of people to go through. Other times patients are adopted or only children, and they have very limited information. So families are definitely different, but that's sometimes an area that can be helpful in better understanding what risks or what different conditions might be on the differential for the patient. And which can sometimes help give us a better sense going in about what risks there are, maybe based on family history. There are some differences or medical problems that would make us think about other risks to the patient beyond just the main referral reason or what brings them in. So it can sometimes be pretty broad, but really talking with the patient about if the family history medical information has changed anything for us, if there are other things on the radar that we want them to be aware of, what would be the potential chances if there's a known genetic disorder, what does that mean for them, statistically, if it's a dominant condition or recessive, and then explaining what that means. So if we have a specific differential of a given genetic disorder, talking a little bit about what that disorder might mean. For adult patients, that's sometimes a little bit different because they, if this is a disorder that they have, possible symptoms of, they might know what it looks like. They've gone through their life with the medical problems that they have. For other people, if it's, genetic testing or conversation about different genetic disorders that they might be at risk to have a child with, then it's important to talk about, what would that look like? What might that mean? Similarly for, predictive testing, if it's a disorder that somebody might be at risk to develop in the future, what might that look like so that they can understand or get a better sense of if this is information that they feel would be valuable to know or not. And then, talking about appropriate genetic testing options. There are definitely cases where genetic testing wouldn't be indicated. And so by getting a family history, getting a medical history, we might talk about why we don't think genetic testing makes sense to do in this situation. In other cases, it would be appropriate to offer. So it's definitely a conversation, again, a back and forth. Genetic testing isn't something that anyone has to do. And it really is, I think, a two-way conversation that we try to have with patients. And if genetic testing is something that is we're offering or that a patient's interested in, really going into detail about what that means, what possible results could come back, what this information might have an impact on or might not have an impact on. There are some medical problems or genetic disorders where knowing the genetic cause or having a genetic test that's positive might change management, or it might change how someone's symptoms are treated, but often it's not. That's not something that would have a major impact. It's typically, treating the symptoms that are there, regardless of if there's a known genetic cause or not. So that might be something that, we talk about as a possible benefit or a possible limitation, and then really going over, different results that could come back from testing. Sometimes genetic testing can give a pretty definitive answer in terms of, yes, we identified a genetic cause for your problems. Other times a no, negative result might not be 100% or, is not 100%, but talking about what that might mean versus a result that's a little bit unclear where, it's something called a variant of uncertain significance, where essentially it's a change in the spelling of the gene, but there's not enough known to say for sure whether that change is harmless or whether it could be harmful. So we're kind of stuck in a gray zone potentially for a while. So definitely a lot of information to go through as part of that informed consent process. And insurance considerations is an element of that as well, both related to insurance coverage for the genetic testing itself, and then if there are any implications or possible risks for insurance discrimination based on the results that could come back from testing. So it's a busy session that we have with people. And for genetic testing, this can look like a number of different tests. There are genetic tests that are looking specifically at chromosomes, which are kind of like the the books on a shelf, if we think about our genome as a library where, it's like the instructions book for how our bodies grow, how our bodies develop. And so genetic changes that stop the genes from working properly can occur at many different levels. Somebody might have differences in the number of chromosomes that they have or how those chromosomes are made up. They might have extra missing pieces of chromosomes, or they might have spelling changes in the genes that are in those chromosomes. So there are different testing technologies that can look for different types of changes. So whether it's a spelling change, that would be done through genetic sequencing, so spelling out the letters of a gene or many genes, or something called a microarray or a karyotype to look at the structure of the chromosomes, kind of get a picture on it if they're all there and in the amounts that we would expect to see, or if there are extra missing pieces. So depending on the indication, depending on what we're considering for a possible diagnosis, that would inform what type of test we order for a patient if we are moving forward with testing. And so there are different considerations with genetic testing in pretty much any situation. Some of the pros could be that somebody might be able to make informed decisions about the future, either for themselves or family planning purposes. That's definitely a possibility that can come back and that information could be meaningful in somebody or change the way that they would want to live their life or change the way that they would want to plan a family in the future, things like that. Since our genes are inherited, having genetic testing, the results might have implications for other people in the family. That might be something that's a pro or a con in some cases, but definitely, there are families where they want to know as much information as possible, and they kind of wait to see what somebody's genetic workup will come back with to see if that's information that would be useful to them. It can help somebody better understand their condition. So in those adult cases, for example, where somebody has symptoms of a genetic disorder, there are some cases where confirming that diagnosis or knowing what genetic change is causing their problems might give us more information on what to expect down the road. Confirming a diagnosis means that we know what something's not, so it can kind of help with their workup in that sense. And again, might help with medical management in terms of there being a kind of indicated treatment to try or medical management option available, or even insurance coverage of a specific treatment if we know that that's indicated based on the diagnosis, but not always guarantee that is the case. And depending on the type of testing, so for diagnostic testing, that sometimes can help with medical management, sometimes not. There are also situations where somebody might have predictive or pre-symptomatic testing, where they are at risk for a genetic disorder based on often family history, but don't have any symptoms currently when they're having the genetic testing done. And so in those cases, it's sometimes helpful to have genetic testing because we know that if somebody were to test positive, there's some genetic disorders where there are options, things that can be done actionably to reduce or prevent the risk for that disease. So in cancer, that's often a big area where knowing that somebody has a genetic mutation that predisposes them for increased risk for different types of cancer would change the way that they're screened. So they might have, mammograms or colonoscopies starting at a younger age than the general population. They might have options for risk-reducing surgeries, prophylactic surgeries, and in an attempt to try to either catch cancer very early or prevent cancer from occurring as much as possible. So that can be an area of genetic testing where results can have pretty significant implications for somebody's care. And there are also, just having a diagnosis or knowing the genetic cause of something can be meaningful to patients in different ways. I think, having a diagnosis and kind of a label or a group that might share the same diagnosis and similar medical problems can provide a sense of community, a sense of a network, and really help with different advocacy efforts, help connect somebody with different resources, and people who are going through similar experiences, which I think can be very powerful. Sometimes there are genetic disorders where the symptoms might be things that are somewhat common or other people might experience as well, which can make it hard for someone to really get across how they're impacted and how maybe other people feel like they understand what they're going through, but it's different. This is something else. So sometimes having a clear diagnosis or a known genetic cause can validate somebody's experience and provide them with a label that they can then share with providers or other people to kind of distinguish their experience, which might be different but not well understood by people around them, which can definitely be challenging. So on the other side, there are definitely kind of limitations of genetic testing as well. So one is cost. The cost of genetic testing and broad genetic sequencing has gone down significantly over the years. It's definitely, people I think have a misconception that genetic testing is always going to be, thousands and thousands of dollars, and that is often not the case. Part of a genetic counselor's job is sometimes to try to figure out what would be the best lab to use, the best test for a patient based on their insurance, based on their income, out-of-pocket costs, that kind of thing. So it's, not necessarily the single barrier to testing, but it's definitely a limitation. And there are cases where, someone's unable to have genetic testing done because the costs are just not accessible to them. So that's still a very real limitation. And as mentioned, the results might not have any real impact on somebody's medical management or treatment. There might be no changes made to their care based on the diagnosis or the results of testing. And while some family members might want to know information, others wouldn't. And so this can be a real source of stress and conflict in families. If there are some people who don't want to know at all, they don't want to know if they are at risk to develop a genetic disorder. But if it's a dominant condition where somebody affected has a 50% chance to have a child affected, if somebody wants to know and has genetic testing, but their parent doesn't want to know, if that child tests positive, and it's coming from that parent's side, then that parent is essentially an obligate carrier of disease and is at risk to develop symptoms as well. So it's not always easy to have genetic testing and be able to honor and respect the wishes of a direct relative who doesn't want to know. So that can definitely get complicated there. It can be, a stressful and anxiety-provoking experience. Some people feel like, they would be more anxious to not know. Other people, find out that they feel more anxious than they thought they would feel. Survivor guilt is a very real thing. So essentially the idea that if there is a dominant condition and each child is at 50% to inherit it, 3 siblings might test positive and 1 test negative. And it can be difficult to get a positive result back, but also a negative result. Why me? Why did I deserve to test negative when my siblings tested positive? So that can be, a challenging experience as well. And then the fact that the results aren't always clear. They're not always definitive. Our understanding of genetics and genetic changes is changing rapidly. And so there are cases where we get back results that we don't understand, or maybe we thought a change did cause disease, and we now have enough evidence to say that might not actually be true. Genetics is an area where there's a lot of gray area and not always black and white. So there can be results that aren't completely easy to interpret, uninformed negative, meaning somebody has genetic testing based on a family history of a disease that they themselves don't have, and we don't know if anyone in the family would have tested positive or negative. The results might confirm a diagnosis, but they might not tell us what that disease course will be for that individual. Will they have especially severe or more mild presentation? We often can't tell that. And there's sometimes incomplete penetrance. So even if somebody tests positive for a later onset genetic disorder, it's possible that they might not develop symptoms during their lifetime. So that's always a limitation as well with how certain we can really be about genetic results. And then as we mentioned, the risk for discrimination. So risk related to financial cost of testing, but then insurance discrimination as well, which there are situations where this is a pretty significant risk. There are others where it's less applicable or kind of less of a concern in a testing situation. There are some legal protections in place. So the American Disability Act, the Affordable Care Act, or Obamacare, and then GINA, which is the Genetic Information Non-Discrimination Act. This is one that applies pretty directly to genetic counseling and genetic testing in some cases. It's a law that was passed in 2008 that protects people against discrimination for health insurance. It does not protect federally against long-term disability insurance or life insurance discrimination. So there are cases where GINA doesn't apply or doesn't offer protections for everyone if someone is an employee of the military or federal government in some cases, or a very small company. So another big part of our job is going through these different limitations, especially GINA and discrimination risks in some cases. So can, again, be a lot of information to go through, but important that somebody knows this and understands these possible risks before having genetic testing. since, once we do this testing, we can't go back. We now might have results that if somebody hasn't kind of planned for ahead of time or thought about what that might mean, that can be, a very, very stressful experience for them. So we'll now talk about what it is like to be a genetic counselor, and I will pass it over to Tala to talk about these slides.
Yeah, so now that you guys have a better understanding of, what we do, who we see, I'm here to share about why you may want to become a genetic counselor. So as you can see on those images, there is an increase in the number of genetic counselors, and it just continues to rise. And we were named one of the 100 best jobs in 2017. So this is definitely an up and coming and rising field. And then just some more stats that really make us shine is that the employment of genetic counseling is predicted to grow 29% in that decade. So, that's pretty big for a new career. More than 87% of graduating GCs had a position before graduation. I actually got my position on the day of graduation, so I wouldn't even count in that stat. The average salary for a full-time GC, is pretty high, and it continues to increase. And then 91% of genetic counselors did report being satisfied with their job. So these are some stats we pulled out just to really highlight the pros of being a genetic counselor. And one of my favorite things about being a genetic counselor is the different things you can do with this career. There's just a lot of diversity in the types of roles and specialties you can work in. So just to go over a couple of them, so some of the specialties you could work in would be prenatal genetics or pediatrics, cardiovascular genetics, cancer, metabolic. You could be doing genomic medicine, pharmacogenomics, neurology. You could also be like Elizabeth and I, who do adult genetics, which means we kind of see any of these in the setting of an adult. So we could have an adult coming in with cancer. We could have an adult coming in with a disorder that's typically seen as pediatric, but maybe they weren't diagnosed back when they were younger. We see neurological conditions. Elizabeth runs a pharmacogenomic clinic at Brigham. So even if you just have one specialty, it may cover a lot of these specialties. And then genetic counselors can work in a lot of different places. So while we both work in the hospital, other genetic counselors can work in universities or laboratories, nonprofits, maybe in industry. So there are really a lot of things you can do with this career. So what I'm going to do is actually go through 3 of the more prevalent genetic counseling roles. These are the ones that kind of started a long time ago, so there are a lot of genetic counselors who work in these roles. So I just want to quickly go over what that may look like for someone. So we're going to start with cancer genetic counseling. It's probably one of the biggest ones, this and prenatal. And cancer genetic counseling really grew quickly. So if you are working in a cancer clinic, or if you're a genetic counselor who is seeing patients with this specialty, you may see patients who are coming in because they have a family history of multiple family members with cancer. And so when you see multiple people in a family getting cancer, you may become a little more suspicious that there might be a genetic risk factor there. Or maybe someone is getting cancer at a younger age. So again, you don't see that as often, so it makes you a little more suspicious of this increased risk. There are also some specific types of cancer that may be more rare, or we may just know more about the genetics of that cancer. And so maybe we'll be seeing a patient for that. And basically what you'd be counseling on are whether they would want to have a genetic test that would know whether they're at risk for an inherited predisposition to cancer. So this would mean that there is an increased risk for cancer that is inherited. And this could be in many different types of cancers. And, like Elizabeth said earlier, typically what happens if you are found to have this increased risk is we talk about, more screenings. So again, possibly mammograms if it's for breast cancer, or colonoscopies for colon cancer. And then depending on what is found, possibly discussing, any type of prevention or surgeries that would be indicated, and if the person wanted those. So the other really big specialty within our field is prenatal genetic counseling. So with this specific specialty, you could maybe see somebody who wants to get preconception carrier testing. So this would mean they want to see if they're a carrier for any genetic disorders, and then possibly have their partner get tested as well to see if there's a chance for them to pass that on. So some people may do that before pregnancy, but some people may also do that during pregnancy as well. And there are also other tests you can do during pregnancy that are just based on general risk factors or family history that people may want to come in and discuss. Sometimes during a pregnancy, there may be a finding on the ultrasound that makes people think about a specific genetic component or a genetic disorder. So that's another time genetic counselors would be seeing somebody who is pregnant, who maybe wants to discuss what was found and what options there are for them. This can be a particularly anxious setting as well. So the counseling obviously can come in here. Maybe someone will have a history of multiple miscarriages. So it's possible that there is some type of genetic component happening there. And again, these are the types of patients Elizabeth and I do see as well, even though we're not in the prenatal genetic counseling specialty. And then there are also genetic counselors who really focus on reproductive genetics. So maybe there is a genetic condition, in the parents or one of the parents, and they want to figure out how they can reduce the risk of passing that on. And one of those ways would be pre-implantation genetic diagnosis. And then the other specialty that I wanted to highlight is pediatric genetic counseling. And so in this setting, typically genetic counselors will work with a physician because oftentimes they'll want to do a physical exam on the child. And so some reasons people could come in for this would be maybe there was a birth difference, and it's possible that this is linked to a larger genetic condition that maybe they only are seeing the birth difference now. Everybody who's born in the US right now does get a newborn screening. So it's a little prick at the bottom of your foot. And if somebody has an abnormal newborn screen result, they may need to go see genetic counseling to see, is there a metabolic condition that, the child has. Sometimes children aren't meeting their milestones at the time that we expect, or maybe there's some developmental issues that you might want to see a genetic counselor for to see if this is linked to any, genetic condition that we may want to be on the lookout for, and again, increase screening for and make sure that the child has all the support. And then again, just like all the other specialties, maybe there's a family history of something that we want to, check out in the child, specifically if there would be some type of issues for the child because of the disorder. So you wouldn't want to do some tests for a genetic disorder in a child that has an adult onset, because we would want to make sure that that child has their autonomy for when they're older. But if there are going to be symptoms for the child, that's when you would think more about testing in this sense. And then I really want to highlight that not all genetic counselors work with patients. So I really talked about the three specialties that are the most common and the most common to work with patients. But we do have a lot of roles where you don't have to actually counsel patients. So if you're looking at all the genetic counselors who don't counsel patients, about half of them work in labs. So these would be counselors who are working in the labs where we're ordering the genetic testing. So we need genetic counselors on that end too to help us, look through what we're finding in these results and help us interpret them. But even when you look outside of just labs and the genetic testing, there are genetic counselors in really a lot of different roles and specialties. And then as you can see in this statistic, about 59% of genetic counselors provide direct patient care, a quarter provide non-direct patient care, and 16% provide both. And I want to really highlight some of these non-clinical roles where you wouldn't counsel patients directly. So in research, Elizabeth and I will talk a little bit more about our own research. But overall, generally, if a genetic counselor is working in research, They are possibly, developing study designs and protocols, again, with all of the training we have in mind. So, what's ethical? How do we integrate informed consent? How do we make sure all of the things that are in a genetic counseling session are still present within research? We may design recruitment materials. We may actually see participants and, people in this regard. They're just not patients. They're the participants for the research. But you may still be counseling and seeing people. On the back end, you may be analyzing data. You may be managing the data. You might be writing grants, writing papers. There's really a lot of things you could be doing within research. Within industry, I sort of touched on this before, but we do need genetic counselors, in the laboratory doing, the variant interpretation and reporting, and also maybe making other healthcare providers aware of the tests that the specific lab is offering. You could also be working in biotech or pharma, so, a little outside of the scope of genetic testing labs, but again, you're still educating, different medical providers, different patient populations. You may be working on clinical trials for a drug for a genetic condition. And so in that regard, you would still need to have all the genetic knowledge that you do. If you're in the public health sector, you could be, raising awareness about genetics. There are different educational groups that are trying to make people more aware of the genetic counseling profession and of the fact that people can see genetic counselors. You may be working on public policy. A lot of people went into working on the Genetic Information on Discrimination Act that Elizabeth mentioned before. You could be working with public health research, or again, like I mentioned before, the newborn screening also had a lot of public health genetic counselors working on that end as well. So a lot of different roles there. And then lastly, you could be working in education. So of course we need genetic counseling trainers, so professors and directors, and you may also just be doing outreach to middle school and high schools and different colleges and universities. And again, I just want to reiterate the point that, Elizabeth and I are doing education right now and making this video. And so regardless of what specialty you're in, you may be doing a lot of these things all just in one role. So lots of diversity and flexibility in what you can be doing on the day-to-day. So I wanted to talk a little bit about my research roles. So you already know that I do clinic with the adult genetics clinic, where I'm seeing adults for all those reasons I've mentioned. But I also work with the Genomes to People research group. And so this research group is really examining, the medical, behavioral, and economic outcomes of doing genomic sequencing on people, and sometimes on healthy people. So one of the projects I manage is the PeopleSeq study. And so in this study, we're surveying people who were healthy people and who got genetic testing. So whether they got that testing through a direct-to-consumer means, or maybe they went through a clinic, or maybe they did some type of research study where they got this information back. We want to know, how did this clinically affect you? Did this change any of your lifestyle behaviors? Did you tell your family? And then economically, how is this affecting both you as a person and the healthcare system? So did you go get a lot of medical tests because of this? Did you change your insurance because of this? So really just looking at the overarching impact of what doing genetic testing looks like and in healthy people. So that way we can further figure out, what policies and implementation do we want to have if this becomes more widespread. And then the other study I manage is called the Reveal Scan study. So this is a study where we're seeing older adults who have a family history of Alzheimer's. And these adults, have no cognitive issues, but we are doing PET scans on them to see whether they have elevated or not elevated amyloid. So in this study, what I personally do is speak to the families and the participants, talk about the study. So I'm educating them and making sure they have informed consent that they want to do the study. And then on the back end, I'm basically counseling on the results of the PET scan. And so even though it's not a genetic test, it functions very similarly in the fact that I'm counseling on what does elevated amyloid mean, and, hitting on those same things Elizabeth mentioned before of sometimes these results, can be ambiguous, and there isn't always a very clear cut answer or next step for what these things mean. So, these are some of my research roles that I wanted to highlight just to show, again, the diversity of what you can be working on, and that the same tenets of communication and education really come through regardless of what you're doing. And so out of all this research through Genomes to People, Dr. Green started this preventive genomics clinic at Brigham. So, in this clinic, we are seeing patients who are healthy and who, are interested in getting genetic and genomic testing. So this clinic, really comes out of all the research we've done, and, we'll continue to look differently as we get more research. But this is now, a clinical offering that came directly from our research roles.
All right, and so like Tala, I have my clinical roles and then research roles as well. So specifically, I'm involved with the Undiagnosed Diseases Network, which is a national program out of the NIH. There are 12 clinical sites, one of which is the Harvard site, which includes Brigham and Women's Hospital, Mass General Hospital, and Boston Children's Hospital. So I'm the site coordinator and genetic counselor for the Brigham site. And essentially what the UDN is it's a program where patients apply or they are referred by a healthcare provider who have undiagnosed diseases. So often severe, kind of unusual, rare medical problems where there hasn't been a clear cause identified. So some of these cases and these patients are, there's kind of suspicion that there's an underlying genetic etiology. Others there isn't, but they, we feel like we could contribute something to the clinical workup that they've had, or maybe there are specialists that we feel could help, learn more about their case or what's going on, what the cause is, even if it's not genetic. But genomic sequencing is one of the tools that we use in somebody's evaluation. So we kind of sort through applications from patients and identify cases that we feel the UDN could potentially help or provide additional care to their workup. And then the Brigham Genomic Medicine as a program, as kind of smaller program within Brigham specifically and with Harvard Medical School. So I'm one of the program managers for that group. And BGM is essentially a research group focused on novel gene discovery and identifying a causative genetic change or difference that can cause either known genetic disease but a new gene, or potentially a brand new genetic syndrome that hasn't been described before. So the two groups have some overlaps and actually work closely in some cases. BGM provides bioinformatic reanalysis for UDN cases that don't have a clear clinical solution or diagnosis that happens through genetic sequencing. So using some research analyses and potentially identifying new genes that can cause medical problems. There is also overlap between the roles that Tala and I have in clinic and research going on. So we both are involved in seeing patients in the adult genetics clinic and some patients in the preventive genomics clinic. I'm also in the endocrine genetics clinic and the pharmacogenomics clinic. And so there are some research opportunities for pharmacogenomics in terms of having a specialty clinical format like that, where it's myself, I'm a medical geneticist and a clinical pharmacist working together. So definitely I think the research aspect can trickle down into many areas, but yeah, balancing the two roles as much as possible. And as Tala said, I think the fundamental skills and roles involved with being a genetic counselor really can apply in a range of different settings and situations. So definitely helps move forward in a number of different ways, and you're never really pigeonholed, which is nice. All right, so hopefully this has maybe made people more interested, or at least not less interested, in applying to pursue a career in genetic counseling. We're a bit biased, but I think it's a great area to be considering. So here are some links to groups to learn more about the application process, genetic counseling in general, and don't forget to check out the other videos on the YouTube channel where you found this one. And if you're watching this before July 20th, please be sure to join our live event happening on July 20th, that afternoon on Monday. There's information at the Eventbrite link posted here. So please register if you didn't already, but we'll have some great resources available through that as well. But thanks so much for watching, and we wish you all luck on your genetic counseling journey.